Hello and welcome to another edition of Capital Calculus. I'm your host, Anil Padmanabhan. India's health crisis is no longer about infections, it is about what we consume. A recent research study based on the ICMR-India Diabetes survey reveals that a carb-heavy and protein-poor diet is causing ill health to Indians. The thing is that this is not just about bad health, it also exacts a staggering cost on both the economy and individuals, especially in our health household budgets. To unpack how India's diet is undermining India's health and its economy, we have with us today Dr. R. Anjana. She is the lead author of the study and managing director at Dr. Mohan's Diabetes Specialities Center. Welcome, Dr. Anjana.
Thank you so much for having me here. Really happy to be a part of this program.
Thank you, Dr. Anjana. I wanted to begin with what I alluded to in the introduction. India's NCD crisis is often called a slow moving pandemic. From your research, how fast is this problem growing and how is it beginning to affect India's workforce and economic productivity?
So those are very good questions, Anil. I think over the last couple of, say, decades, there has been a massive increase in the number of NCDs, which include diabetes, prediabetes, obesity, hypertension. So these are all metabolic NCDs. There's been a large increase in these numbers all over the world, but India is, I think, at the center of simply because of huge population that we have. We're right at the center, the epicenter of this, let's say, pandemic. And over the years, we see that overall there has been a doubling in number of people with all of these NCDs put together. And a lot of our workforce, those the problem with diabetes in India especially is that it comes to people of younger ages. So the age of onset of diabetes in Asian Indians is in the age group of 25 to 34 years, as compared to any, let's say, Caucasian population where it's at 50, 55 years plus. So this affects, number one, the lifetime risk of having diabetes, maybe not having control complications, all of that. So that's one pathway, but also the ability, like you said, the workforce, productivity, economic problems, all of these become an issue when you have a younger population with diabetes. So yes, it has been increasing quite a lot, and especially in younger groups these days.
Okay. According to WHO, the NCDs account for almost 68% of the deaths in India, is almost 3 out of 4. So, my question is, are we underestimating the economic cost by focusing purely on the health aspect of it? One, you of course alluded to the productivity, but healthcare spending, particularly in individual household budgets.
So all of this is true. So there are many parts to this. One is, of course, getting the disorder itself. Any of these, right? Obesity, diabetes, etc., is associated with healthcare costs in our country. Most of it is pay out of pocket, so that becomes burden to the individual and their families. That's one aspect of it. Now, what happens is that if this is ignored or not looked after well enough, one or more of these would progress into complications. So now these include things like heart attacks, kidney failure, strokes, blindness, amputations. These can be, and of course, these are the kind of end stage. There can be various degrees of all of these, what I just spoke about. So now when we're talking about cost, you're talking about tripling or any of the costs that we're talking about just with having, say, diabetes. If you end up with a heart attack or a kidney problem, we're talking different level of spending for the family per se. So that is at the individual level, at the household expenditure level, etc. Now, if you look at healthcare burden, there are again huge costs here. Now, 70% of India lives in her rural areas. Still, I mean, this is changing, but still around that number, we still have a large population living in rural areas. Now, the minute we start having diabetes, and we did show in the INDAB study that diabetes is moving to from urban to rural areas. We still have very high prevalence in urban areas, but rural areas are catching up. And the problem about rural areas, every percentage increase in prevalence is associated with huge burden because of population size, right? And these are not the people who perhaps can afford, understand literacy is an issue, accessibility is an issue, all of this becomes a problem. So what happens is, again, the burden of the healthcare system gets more. And what happens is, now economic costs of managing these patients, providing medications, again complications, you have to provide education, you have to, there's so many things. It's not like, a one time thing where you give fever, you give a drug, it goes away. It's not like that. It's for the rest of your life. So having these patients, empowering them, otherwise they'll develop complications, looking after them, huge costs any way you look at it. So then you may ask, okay, so what's the best way to prevent all of this? Can we, of course, if you have any of these, you can prevent the complication, but how can you prevent it from happening itself? Yes, you can. And but there are costs there as well. So here you're talking now about healthy living, healthy lifestyle. What does that entail? That entails a good diet, physical activity. So if I tell you eat a lot of fruit and vegetable, they're expensive. Nuts are expensive. Anything that's healthy is expensive still in our country. So there you have expense as well. So now you'll ask me, is it perhaps better to get the disease and then treat? Is that cheaper than actually trying to buy fruit and vegetables? I don't have any good answer to that, actually. And these are problems that are there. Physical activity. If you tell someone to walk, patients often ask me, doctor, where am I supposed to walk? I can't walk on the roads. There's pollution, there's traffic. I'm going to get run over by a vehicle. Okay, there are parks. Are they there in all places? Are they functional? Are they, I can't afford a gym membership. So these are practical issues that we face. All of these are addressable issues, but I think it's important to recognize that they're there and that we do something about it collectively.
So, Dr. Anjana, it's interesting what you said that it is now spreading from urban to rural areas. But I'm curious to know, why is it that Indians are more vulnerable than, say, Caucasians, which you had said in your introductory remarks? Is there some historical reason, or is it something to do with our physiological being?
So it's a mix of everything. And Indians traditionally have been through a lot of famines. If you look at, our history, our body types are meant to conserve energy. So our genotypes, our body endotypes, all of these are meant to conserve energy simply because we didn't have access to enough food. There was malnutrition. All of that was there in say the days gone by, years gone by. Now, what has happened over time? All of that has self-sorted itself with the food revolution, milk revolution, all of this green revolution, all of this has happened. And now we have surplus everywhere. And with this surplus comes excess access, availability of high calorie food, let's say. And now you're consuming this food, it's affordable, right? So you're consuming it. Your body is, kind of trained to harvest maximum energy about whatever you consume. You're gaining weight. So if you don't expend, we used to also expend now in rural areas, for example. We didn't have before the all of this urbanization, industrialization hit us. People were walking around behind bullocks, right? That's what we were doing. Farming was high manual labor. Today, none of that exists. We have the good things of having industrialization, mechanization, the byproduct of which is that you get less physical activity overall. So you're taking an excess calorie, you're not burning enough. Even in rural areas, you have access to sweetened beverages, to junk food, to unhealthy substances. Always in every village has your Pepsi and your Lay's, right? So you have all of that, and that is leading to fat accumulation. Yeah. Now that's an overall picture for the why diabetes is increasing more now, and why is it also going to the rural area. That's the explanation. Now, compared to the West, we think we do have some genetics that are different from Western populations. Indians have a lot of insulin deficiency. So we don't secrete as much insulin. that the Western people, if you look at them, they have more muscle mass. Indians have less muscle mass. Bone density is less. Our insulin secretory capacity. When people were not so obese, that was all fine. But now with increase in body fat and all this is manifesting at younger ages itself in our population.
All very scary. But it's interesting that what was a defense mechanism against, say, malnutrition and lack of, good diets is now become a liability in good times when actually India is doing well and food
Yeah,
is affordable, right?
yeah, yeah,
So, in your same research paper, you flagged the point that 60% of our diet is made up of carbs. So, you one of the reasons is what you just said, that we came out of food deficiency, so we were focusing on cereals.
yeah.
uh, is it also a cost factor on the lack of proteins in our diet?
So yes, so what, like you rightly said, the reason, see, once we got the green revolution and we were able to produce enough food, for our own country, the primary, let's say, cultural nutrient in our population is carbohydrate. And the problem was that we did not have access to enough cereal staple energy, and thus once that was corrected, that was the one that was considered the most populous macronutrient to give out. So yes, and it's corrected a lot across the country. It's corrected, let's say, malnutrition of undernutrition on one side. But today we're living in a different scenario. So that was relevant for a couple of decades ago. That was completely relevant. It was the right thing to do. Today the scenario has changed, and thus there is requirement for change again to see that our population stays healthy. Increasing protein intake, we are protein deficient across the nation. Requirements say that you have to have about 20% protein in your diet. We only stand at around 12%. Northeastern regions of the country consume the highest protein. The rest of India is all quite low. So the protein requirement, the problem about protein is that it's expensive. So that's where we have, and that's probably one of the reasons why people don't consume as much. So those are the things that one definitely has to look into.
And for the sake of our viewers, when we eat proteins, we have vegetarians and non-vegetarians in India. So could you just, broadly set out the food categories that either cohort could consume?
Sure. So protein, it doesn't matter whether you're, vegetarian or non-vegetarian. In fact, in the paper, we showed that the best protection from diabetes was if you reduced 5% of carbohydrate and replaced it with plant protein. So that actually had the best benefit. We also have dairy protein that is protective. And if you combine these two, it has a synergistic effect. So it's better overall if you have plant plus dairy. Now, plant, you can, all your pulses, legumes, soya bean, whatever, any plant source of protein is acceptable, depends on what you like to have and thing. But just overall to see that there is protein with every meal. The problem about plant protein is you have to have larger quantities because the biological availability of plant protein is less than animal protein. Dairy protein, there's a lot of controversy around it. So all over the world, people say milk is bad and all that. But consistently from India, we are showing the types of cows we have, the types of the things we do with our milk. We primarily, India has milk as milk and buttermilk, curd. These are the three ways in which we consume. These are considered healthy forms of milk, and our milk subtypes are actually quite healthy. So they protect. Our dairy is that we don't have much of other kinds of dairy, fermented dairy. We don't have much. We have it, but our larger consumption is of curd and buttermilk and things like that, which is all healthy and protective in our pop. So if you do a dairy plus plant protein, it's great. Now, if you like non-vegetarian food, that's perfectly fine too. Fish is supposed to be the best among all of the animal proteins. Eggs are good too, especially the egg whites are very high source of protein. Chicken is so. It's not. It's not. It's on the line. It doesn't protect. It doesn't give you risk. It's okay if you like chicken, that's not a problem, as long as you're not frying it. And red meat is associated with risk. So red meat is best avoided. So that is mutton and beef and all of that. Best avoided. Of course, occasional is fine, but on a regular basis, fish I think stands out as the most protective one.
So, Dr. Anjana, from what you just said, and tagging to what you said earlier, one, the India's traditional habits with diet, plus the fact that proteins are expensive to add to the diet, does this make this challenge, this diet challenge, worsen the economic inequality in this country? Because there are health costs which you detailed right at the beginning. So individual health household budgets, it can blow a hole in them.
Yeah. So that's a very important question. And when you say this is always a question I get asked. I think the only way we can change this if you have collaborative public, private, governmental involvement. So our public distribution systems, what do they hand out? They hand out rice, cereal, or wheat. They give you sugar and they give you oil, perhaps not the three best choices, right? So while they're staples, I think it is after this paper, we are looking to make recommendations which, perhaps also have pulses and legumes handed out in our public distribution systems, making all of this more affordable to the general population, which is what we have to do to move the needle if people need access to good quality protein as well. So at least the plant protein can be handed out in some way so that a large group of the population are able to access healthy forms of protein.
In fact, if you give pulses in as in the through the PDS, you can also contain food inflation in this country, which
Yes,
is
yes, yeah, 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 of course.
so. You in your research paper, you found that even 5% of calories from carbs, if they're substituted with protein, what you mentioned, pulse, legumes, and dairy, it significantly reduces diabetes risk.
Yes,
So
yeah.
why is India, still a protein deficient economy and a diabetes capital when the fix is so easy?
I don't think we knew exactly what it was. So when you talk about see, everyone generally knows that we eat a lot of carbohydrate. That is a general sense that everyone has. But how much are we eating? How much should we eat? Those answers we didn't have. So what people do, they go from like 100 to 10. You can't do that, right? If you're eating 70% protein, I mean carbohydrate, that now from this study we have shown that if you just make say 70 to 50, you're very good. Even if you don't do that, if you just reduce by 5%, you're good. So I think those kinds of information have just come out, and following this we hope that policy level thing, if you look at the northeast, that they have the lowest prevalence of diabetes. They also have the highest carbohydrate intake, but what is protecting them is the protein. They have the highest protein, highest carb. So if you have that carb, if you kind of buffer it with protein, it protects you from both obesity and diabetes. So I think that's a larger lesson that came. It was new to us also. So now I think clarity has come on how much people should have, what is the actual health benefit, and things like that. So hopefully guidelines will come after this. Recommendations should come in.
So, in that sense, your research study is a benchmark publication since it provides empirical evidence about what we have always felt anecdotally.
True, it has produced, we've put figures and numbers to things which are general sense you have, but then you don't have the exact, policy level recommendation, what could be done. We didn't have anything for that. We do now. We do now.
And actually, if indeed the government does accept your policy recommendation and they seek this pivot away from carbohydrates dominant to slightly protein heavy diet, then it has a collateral gain because you will start promoting dairies, milk cooperatives, and so on, right?
Yeah, why not? So these are all healthy sources of protein. We already had a 1 egg a day uh murgi ke ande we used to have, no, we used to have the public promotion
Campaign,
system
yes.
campaign. Yeah, so why not? Milk is good for, and we are in the country right from children. We have most of our Indian, if you look at them, sarcopenia is a big problem. That means we don't have enough muscle mass, we don't have enough bone density. So starting right from childhood with milk and eggs and all is a good thing. So by the time these people become adults, they have good height, they have good body mass, they have muscle. These are things that are going to protect them later on in life from all kinds of diseases.
Okay. So finally, Dr. Anjana, I want to ask you that realistically, given all that you know on the health side of things, you also know on the policy side of things, can we realistically hope that India can escape this carb trap?
I think we can. I think we definitely can. It's not a carb trap. So there's nothing wrong with cereals, right? Cereals are energy. Carbohydrate is a much needed nutrient. It is the quantity of the carbohydrate and the quality of the carbohydrate that one must take care of. So there is a lot of good carbohydrate as well, right? So you have fruits and vegetables that have carbohydrate in them. They're all good carbohydrates. We're only trying to prevent refined carbohydrate, or high sugar starch carbohydrate. That is the carbohydrate we can perhaps do without. But if we want to have good carbohydrates, good cereals, and good energy coming from that. And what do we? So the minute you decrease something, you have to replace it with something else. The watchword there is, don't replace it with fat. So right now the country is doing well right now on fat, 25% fat. It's really good, stays there. You shouldn't go and switch it with fat, rather switch it with protein. And overall, being protein deficient, I think that's going to have huge benefit. Ask me if you think it's possible. I think it's definitely possible. It just requires a lot of push and effort, and our country is amazing. It can do whatever it sets out to do. You just have to, the right people should hear of it, and the right steps have to be taken, and then it gets done.
So, very nice and positive note to sign off on what is an inclement health challenge. Thank you for speaking to us, Dr. Anjana.
It's been a pleasure. Thank you so much for having me.
So, the science is clear. India's high carb, low protein diet is creating a dual challenge with respect to its health and its economy. But, like Dr. Anjana explained, a slight tweak in our diet preferences away from processed carbohydrates to more proteins in the form of dairy and less sugar, etc., can generate national dividends in trillions. This is about eating smarter, both for our bodies and the economy. A healthy India is a wealthy India. Thank you for watching. Don't forget to subscribe to StratNewsGlobal.Tech on YouTube. Hit the bell icon so that you don't miss any updates. And please do share your thoughts, ideas, and suggestions. I'm available on X at Capital Calculus. I'll be back next week with another episode. Till then, stay safe.